And welcome to KGW News at 5 o'clock. Our top story, we are 6 days away from Oregon's COVID vaccine mandate kicking in for healthcare workers and others. Some have said they will fight the mandate, but others have used the deadline as inspiration to get their COVID shot.
KGW's Pat Doris talked with a healthcare leader at Legacy, which was among the first in Oregon to issue their own requirement.
Roughly 14,000 people work in the Legacy health system. And when Legacy laid out their COVID vaccine mandate, they went far beyond their employees.
Anyone who comes to a Legacy facility, whether it's a hospital, a clinic, an outpatient, environment, any Legacy person they interact with, whether it's a volunteer, an employee, a provider, a student, any Legacy person, a vendor, they interact with or they see will be fully vaccinated.
Sonia Steves is the Vice President and Chief Human Resources Officer for Legacy Health. She said the system's firm stance has helped increase vaccinations there.
From early August, we have tried to be extremely clear about the consequences and our commitment to having an environment that is 100% vaccinated.
Legacy reports that before the mandate, 85% of all employees were vaccinated. Now, with the mandate, the number has moved to 95%. Another 1% have at least one dose. About 700 are on unpaid leave. Kaiser Permanente reports before the mandate, 79% of workers were vaccinated, and after, the number moved to 89%. About 170 are on unpaid leave. Providence reports that their vaccination rate moved from 80% to 90% with the mandate. At OHSU, the mandate moved the vaccination rate from 86% to 94%. And Salem Health reports their vaccination rate moved from 75% to 88% after the mandate. Back at Legacy, Steve said hundreds applied for religious or medical exemptions, but a majority were rejected. She won't say exactly how many. She anticipates lawsuits to try and stop the mandate. In the meantime, she said Legacy is hoping the holdouts will change their minds and get vaccinated.
We will, when they meet that requirement, we will welcome them back and we will honor, if it's within a year, we'll honor all of their years of service as a rehire.
Pat Doris, KGW News.
Washington State's vaccine mandate for many workers takes full effect Monday, and it appears that has pushed vaccination rates up. At a free medical clinic in Longview, they've been administering a lot of Johnson & Johnson vaccine. The nonprofit Community Health Partners runs the clinic. They say they started getting more people coming in for vaccinations in the past few months as mandates were announced, and the Delta virus drove up cases and deaths. Still, they find people who are not too keen on getting the vaccine, but are getting it anyway.
We'll give them all the science information, and we're not trying to twist their arm, but we'll go as slow as they need to go before they have their shot, because some people are just scared.
Cowlitz County's vaccination rate is well below the statewide average, with just over half of eligible residents fully vaccinated. Those who got the Moderna or Johnson & Johnson vaccine might receive their booster shot soon. FDA advisors are set to meet Thursday and Friday to decide if the extra doses of the vaccines should be distributed. The advisors will also recommend who should get the shots. The final decision is not expected for at least another week. Next week, the CDC panel will discuss who should get boosters. That decision needs to be approved by the CDC director, Rochelle Walensky.
A Colorado woman on the transplant list claims that she can't get a new kidney because she's not vaccinated. Brandon Lewis from our National Verify team looks into whether hospitals are requiring vaccines for transplant candidates.
Public health officials continue urging people to get vaccinated against COVID-19. But some Americans are choosing not to for a variety of reasons. Now, a viral post from Colorado State Representative Tim Geithner claims a hospital is denying transplants to the unvaccinated. So let's verify. Can hospitals require organ transplant patients and donors to be vaccinated against COVID-19? Our sources are the University of Colorado Health, the American Society of Transplantation, and the American Hospital Association. Geithner's post includes an image of a letter supposedly sent from UC Health to a patient explaining they were essentially taken off the transplant waiting list because they are not vaccinated against COVID-19. UC Health wouldn't confirm the authenticity of the letter, citing patient privacy rules, but confirmed it is now requiring transplant recipients and living donors to be vaccinated against COVID-19. It cites a European study that found unvaccinated kidney transplant patients have a 21% mortality rate from COVID-19 compared to less than 2% for average people who are not vaccinated. The AHA notes transplant recipients aren't just more susceptible to COVID-19, but other infections as well. That's because they're on powerful immunosuppressants to prevent their bodies from rejecting a new organ. UC Health isn't alone. Hospitals in Washington and Ohio are also requiring COVID-19 vaccines for transplants. So it's true. Some hospitals are requiring organ transplant patients and donors to be vaccinated against COVID-19, although that's not the case at every hospital. With your Verify, I'm Brandon Lewis. To receive daily fast facts to your phone, text Verify to 202-410-8808. And to sign up for our newsletter, visit verifythis.com/email.
For the past 2 months, we've been telling you how a surge of Delta variant cases has overwhelmed hospitals in Oregon and Washington. In August, we took you inside 2 Oregon ICUs, one of them the Medical Center ICU at OHSU. This woman, Miranda Rich, recovered there and reached out to us when she says she saw herself in a KGW story about the overwhelmed ICUs.
And I was like, maybe they need to know that somebody made it. That somebody out of the ICU actually did make it and is alive. I don't want to be known as the heartbreaking case of a young woman who was unvaccinated and covered in tubes.
Coming up at 6 o'clock on The Story, hear her miraculous story and what she wants the healthcare workers at OHSU to know.
Former long-distance runner Mary Kane filed a $20 million lawsuit against her former coach, Alberto Salazar, and Nike. The lawsuit alleges Kane faced physical and emotional abuse while training with the Nike Oregon Project. The program was led by Salazar and provided training to long-distance runners. Kane joined the project in 2013. She says Salazar pushed her to train while she was suffering from painful injuries. The lawsuit said Nike was indifferent to Kane's health and safety. She first spoke out about her experiences back in 2019 through a New York Times interview. Salazar has denied all abuse allegations.
Next week marks 6 years since the murder of Dion Matthews Jr. His case remains unsolved, but his mother is hoping that this year changes that. Matthews Jr. was shot and killed back on October the 18th, 2015. The deadly shooting happened in the parking lot behind Dante's nightclub at Southwest 3rd and Burnside. Witnesses told police that people ran and drove away from the scene after the shooting, but there have been no arrests in the case. That just eats away at Dion's mother, who worries that her son's case just isn't a priority anymore when you look at the gun violence plaguing Portland right now.
At times I do feel like it gets lost. Because they're so overwhelmed in doing and trying to prevent other homicides and crimes that's taking place out there in Oregon. But as me being a mother, as me being an advocate, not only for my child that got murdered, just for other families. You know, if we come together, we speak up, we stand up, that's not snitching, that's not ratting no one out, that's just doing the right thing.
She is hoping anyone with information about the case passes it along to Portland police. Remember, you can do so anonymously.
An Oregon man behind some of the world's most iconic advertising campaigns passed away on Sunday at the age of 82. David Kennedy and his partner Dan Wyden founded an agency here in Portland back in 1982. They went on to produce huge campaigns like Just Do It for Nike. Now the firm has offices around the world and decades worth of memorable campaigns. University of Oregon advertising professor Deborah Morrison says Kennedy's work will influence people for a lifetime.
Advertising has so many things to fix about within the industry. He is a good ancestor for us. So how do we pull that through and become good ancestors for the next generation of talent?
Morrison and her writing partner are working on a book about the creative process, and David Kennedy shared his thoughts and illustrations for the upcoming project.